all, today let's discuss about irrigation protocol. I am sure many of you will be doing routinely root canal treatments, pulpectomies, and so often we forget the importance of irrigation protocol. So it's not just what to use, but also you have to know the how and when to use of different irrigants that are routinely used in endodontics. So this is the protocol that I follow for the permanent teeth in adults as well as for primary teeth. So the importance of an irrigant comes with the fact that a lot of areas in the pulp can remain untouched by the files you use. So you have to use irrigants very deliberately. So the most common and the most important one is definitely the sodium hypochlorite. And there are various formulations available. We use either a 3% or a 5% formulation here. And there are various things that you can do to increase the effectiveness of using your hypo. One is that you have to use it for enough number of time. That is, once you make sure that your canals are filled with hypo, make sure that it gets enough exposure time. So it could be like a 3 minute is more effective than a 1 minute. So if you are keeping hypo, make sure it is there for enough time. Another thing is you have to keep refreshing it every 2 minutes because the chemical activity will come down. And another major importance is that once you flood your canals, make sure that you do some form of activation. Either it can be a laser or an sonic or an ultrasonic activation. So this is an ultrasonic tip that you can, once you flood the canal, you can put it and activate it. So activating the irrigant definitely increases the outcome. So whenever I start my access opening, the first irrigant that goes in is always a hypo. Because that will again ease in removing the pulp tissue first. So one thing that worries dentists in using hypo is an apical extrusion and its after effects. So the one way you can avoid apical extrusion is by using a side vented needle for your irrigation. So the tip will be like open only on the sides, and this kind of limits the apical extrusion if you push hypo into it, but never limit your RCT without hypo. Always use hypo because it is very effective. So after we use hypo, it is always followed by saline. Now there are two more irrigants that I use, not together but separately. So the most common one is definitely the EDTA. So EDTA is available either as a liquid form or in paste form, that is a RC help that you use. So RC help is like a little less concentration of EDTA. And also the fact that it is paste form, there are several studies that says that paste form is more effective in the coronal and middle part but not so effective in the apical part. So when you consider EDTA as your irrigant, in the apical area it is not so effective. One thing is that it cannot reach. Second thing is that it depends on the file taper that you use. So if you are using a greater taper file, say 12% when compared to a 2% taper, the contact space and the volume that EDTA that can be there between the canals is much less. So this makes a liquid form of EDTA to be more effective than the paste form that you use. Although EDTA is a good irrigant, but it should never be mixed with hypo. Now there are several irrigants that shouldn't be used together. So hypo should definitely be not used along with EDTA because the effectiveness of hypo will be limited by EDTA because EDTA is a chelating agent. So we will not use EDTA and hypo side by side. So after hypo we would flush with saline, and once you make sure that hypo has done enough work, then only we will go to the next set of irrigants. So after hypo is saline. Then EDTA liquid is indicated by most research studies to be used as in the end to give a good smear layer free canal space that would help for your three-dimensional obturation in the end. So that is the most important use of using EDTA in the end. So another important irrigant that we use here is the chlorhexidine gluconate, which is a 2% formulation, and it is very much different from the mouth rinse, which is 0.02%, and this is the one that has to be used as a intracanal irrigant. Most of the cases I use it in two-visit treatments where there is a lot of abscess, and I use this as a last rinse before giving my intracanal medicament. Again, this shouldn't be mixed with hypo. I will just demonstrate what will happen if we mix hypo with chlorhexidine.
So here in this dab condition is some chlorhexidine irrigan, and the syringe contains hypo, and you can see why exactly we say it shouldn't be mixed together. This is what happens if you mix hypo with chlorhexidine, and you don't want this inside your canal. So always after your hypo, you would definitely irrigate with enough quantity of saline. Then only you would either go for your other forms of irrigants.
Hope this video was of some use to you. Wish you a good day.